Hey guys, welcome back to my channel. It's your girl Sinead and I'm back with another video. So in this video I'm going to be giving you guys all of my tips for surviving first year of medicine and having a smooth transition from sixth form to medical school. So if you haven't already, make sure you subscribe and like this video and comment any questions that you have at the end. So without further ado, let's get straight into the video. So my very first tip, which in my personal opinion is more important than all of the other ones, is to find the older years notes. So when you're in medical school, there's no point making your own notes because there's so much work to do, and making your own notes just isn't efficient for preclinical years. And also the curriculum is probably the same as it was for the older years as it is for your year, so just do yourself a favor and use older years notes. I also say that you don't necessarily have to use the first set of notes that you come across, because some people might structure their notes in a way that you don't understand or isn't easy for you to digest. I think in that case it's still useful to have a set of notes that is a summary of the lectures, and if you feel the need then you can always restructure them and use them as the basis for your own revision material. So overall you're still going to save time in comparison to you making your own notes completely from scratch. Other things that you can get from older years are flashcard decks. So a lot of medical students do use flashcards to revise, so you might choose to get some downloadable Anki decks or some Quizlet sets from other people at medical school. But I will say that making your own flashcards is beneficial to your revision because you don't want all of your studying and learning to be completely passive. So what I did is I would get older years notes and then I would make my own flashcards from the summaries and the notes that I had. And as I said, a lot of medical students do use flashcards to revise, but if you try it and you feel like it doesn't work for you, then that's absolutely fine. There's plenty of other active recall methods and revision methods like practice questions, etc. that are useful for your revision and you may feel work better for you. But the majority of people I know do use flashcards and find them very useful. So the next thing that I think is essential to not just first year medicine but your entire experience at medical school is a question bank. So practice questions are probably one of the best ways that you're gonna revise at medical school. Having a good question bank is gonna help you to test your knowledge. So there are a couple different ones that medical students use, but the most popular ones are probably PassMed and QuesMed. At UAB we also use Peerwise, which is where students can write questions and other students can answer them. Obviously that has its pros and cons, but it was useful for modules that weren't necessarily included in the more public question banks. So I think it's a case of just trying a couple. I think most of them should have free trials or at least discounts so you can try them and then see which one aligns best with your curriculum at your uni. Also, your medical school should give you some practice questions and formatives anyways, so those are going to be the most relevant to what's going to be on your exam. And you can also ask the older years what they got tested on in their exams, so you get an idea of what's more likely or less likely to come up and where you should be focusing your revision. So next I'm going to talk about textbooks. So your university should give you access to most of the textbooks that you need or the ones that they recommend. Overall, I wouldn't recommend buying textbooks unless you physically cannot function with an online version or if you prefer a physical textbook. If I'm being completely honest, I didn't really use textbooks that much in my preclinical years. If I had questions, I would just ask a teaching fellow or someone in my group to explain it to me. I feel like I only really used textbooks when I needed an answer there and then and there wasn't really anyone around to answer the question. Sometimes looking through textbooks isn't the most efficient way to study because there is a lot of information within a textbook and sometimes you don't need all of it. So textbooks are something that if you do find them useful then definitely use them, but it wouldn't be at the top of my list of recommendations. So moving on to learning anatomy, there will obviously be the sessions and lectures that your university give you, and then there'll be different ways that you can like revise it and study it on your own. So for me personally, I used YouTube videos, apps like Complete Anatomy, and also websites such as Teach Me Anatomy to revise it. I sometimes use the Grey's Anatomy textbook, which the university gave us access to, and I would use that if I wanted to find more specific information or double check something that I saw online. So I will give a disclaimer that I have been told Teach Me Anatomy isn't 100% accurate. I personally haven't come across anything on there that's wrong, but that being said, it may be useful to just double check with your textbook or the notes and slides that your university has given you, because you don't want to put anything incorrect on your exam. Another technique that I found really useful was the image occlusion add-on in Anki. So what I would do is I would take the diagrams from Grey's Anatomy, for example, and then cover up all the labels, and then Anki would essentially give me the flashcards to guess the structures. And I just found that that really helps me to know where things are. Obviously it doesn't help with the sort of explanation and the finer details, but definitely with a lot of the basics, that's how I learned most of it. So I'd say my main tip for anatomy is just try a couple of different things, and whichever you find works best for you, then stick with that one. I'm just going to touch on some extra resources that I found useful in first and second year. So the first one is Radiopedia. So Radiopedia is a website where you can find a whole bunch of CT scans, MRI scans, basically anything related to radiology. For me, radiology isn't my strongest subject, so I found that that website helps me to get used to looking at radiology images. I think for this you don't necessarily have to go out of your way, because your uni should obviously give you sessions dedicated to looking at scans and looking at clinical anatomy, but if you just need a little bit extra, then I found that Radiopedia is very useful. You don't need to know a whole load of clinical stuff in year one, but other websites that I also found useful included patient.org and BMJ Best Practice, if you want to know like symptoms, treatments, etc. Overall, I just want to say that the learning style in university is different to the learning in sixth form, so it will be a bit of an adjustment. So you just need to be aware that the techniques that you use for your studies previously might not work for university revision. So definitely take some time to understand the structure of the course and try a few new different ways of revising the material. So I'm going to move on to some more general advice for your first year of medicine. So the first thing I want to say is to try and enjoy as many things as you can in first year outside of medicine. I say this because first year and probably second year as well are the years where your course structure aligns more with other courses in the university. For example, things like societies will put on events that are tailored to the general university course structure, whereas when you get to clinical years, for example, you're at placement sometimes from 9 to 5, and let's say your placement is 1 hour away, you won't necessarily be able to get back to an event that's starting at 6 p.m, or sometimes there's even events at like 1:30. That's obviously not going to work for you. So definitely try as many things as you want in first year. And when I say that, it doesn't mean that enjoyment stops in clinical years, but it just means that in terms of the course structure, your first and your second year is going to be easier for you to meet people from other courses. Another thing which is very important is that you shouldn't be trying to do everything in medical school by yourself. Obviously you'll have group work and things like that, but I think in general you should really try and be as collaborative as possible. Share notes, share flashcards, etc. There's a lot to do in medical school, and it's no use you trying to do everything yourself, because you're just going to get overwhelmed and you're going to get burnt out very quickly. There isn't anything that you need to prove by doing everything by yourself as a medical student. So share notes, share flashcards, and you'll have a much better experience that way. So another very important point is to stay on top of your work. So this means doing any lectures or any work that you've been set in the week that it's been set. Being behind is not fun, it's stressful, and it's just unnecessary stress that you don't need in medical school. So try your best to stay on top of the work. It is a lot, but with good time management you should be able to stay on top of it. I also want to say that you should try and stay as organized as possible. So this includes general things in your life like your time management, and also things to do with university such as organizing your notes and your study material. So I like to use apps like GoodNotes and Notion to organize things for university. I also use my calendar a lot to time block my day, so that way I know what I need to do at any given time. My my final tip is to obviously take care of yourself. There is a lot to do at medical school and it can get overwhelming at times. So if you ever feel like you need to take a breather, please do that, because you don't want to get burnt out. Obviously attend all of your mandatory sessions, but if you ever feel like you need to just take a day off and not go into uni and just sleep all day, then definitely do that. So yeah, work hard, but don't overdo it to the point where you're too tired to even function. So yeah guys, those are all of my current tips for surviving first year of medicine. As I said, it will be a bit of a steep adjustment, but after the first few weeks you should get settled and everything should be fine. I hope you guys found this video useful, and if you did, make sure you like this video and subscribe to my channel for more videos. Comment any questions that you have and I'll make sure to get back to you. And with that being said, thank you guys for watching this video and I'll see you guys in my next one.